Thank you very much, audience. Hi, my name is James Malik, and I'll be your host for the GMT show, a late-night talk show series. We will talk about all the hot topics pertaining to medicine. Well, for tonight's show, I'll be featuring Robert Johnson, which is a health policy analyst who also happens to be a personal friend with a great sense of humor. Well, so without further ado, please, I'll introduce you to you, Robert Johnson.
Hey, how are you?
Great. Please.
Thanks, everyone. Thank you.
So, Robert, it's great to have you here.
Thank you, James. Thank you. It's great to be on the show. Wonderful audience. Long time.
It has been a long time, right?
Yeah. Tell me, James, is this the show where you give out cards to everyone?
Oh, no. That's Oprah, not me. In my show, we talk about more serious issues. Well, convincing your kids that you're eating all their Halloween candies is one of these.
Yeah, totally forgot you're not Oprah.
Well, she retired too, you know.
Must be the resemblance.
Very funny, Robert. See, I told you he's a funny man. So, moving on to more serious matters. We prepared a few questions for you in our Ask Me Anything segment. Are you ready?
Absolutely. Fire away.
Well, the first question comes from all-knowing citizen 123, and he's asking, and I quote, "So, I've been hearing a lot of fuss about this refugee healthcare business. What is this all about?"
Well, all-knowing citizen, the federal government of Canada has a program called the Interim Federal Health Program, which really serves as the health insurance plan for refugees. Back in April of 2012, the government of Canada decided to downgrade the health coverage on this plan, with some sweeping changes that were put into effect just a couple of months later.
And that, of course, caused a lot of massive public outcry.
Given the drastic changes, I see the response of the public was just appropriate, James. You see, to understand the impact of the changes, you first need to understand the different types of refugee populations in Canada and the previously available coverages for each of those populations. Simply speaking, there are two main groups. Firstly, there's the privately sponsored refugees, people who are identified as refugees before moving to Canada. Upon arrival, they were given health insurance by their province, but really they relied on the Interim Federal Health Program for access to medications, vision, and emergency dental care. And then, of course, there's the other group, the refugee claimants, those who make the refugee claim after landing in Canada. Back before the changes, they could access physicians and obtain lab and diagnostic testings, but only through the Interim Federal Health Program. Refugee claimants are then subclassified if they belong to one of the designated countries of origin. So these are countries that the minister thinks should not be producing refugees. So in general, the changes meant that all refugees, other than assisted government refugees of course, lost access to medication coverage, vision, and dental care through the Interim Federal Health Program. Furthermore, people from those designated countries of origin we were speaking about, they could no longer have health coverage for urgent or essential care as they did previously. You can imagine this has been an issue of serious ongoing debate.
Right. Thank you, Robert. So we have another question. This is from Refugee Healthcare Rocks, and I quote, "What was the rationale for the refugee healthcare cuts?" Could you explain?
Well, there's really three components to this answer. Firstly, the government would say that, the federal government of course, that over the next 5 years from the implementation of the changes, they would be saving approximately $100 million. However, if you ask me, I don't think this is entirely accurate. Surely, untreated illnesses that are not included in this calculation will have their own costs. Moreover, why is it that we are not thinking about the health costs that would be incurred when some of those refugees become Canadian citizens? And at that point, of course, they'd be covered by the government for their healthcare costs. The second argument comes in when the government says these changes would bring about equity to the level of healthcare that's offered to refugees and Canadian citizens alike. However, the way I view it is, with all the new changes, refugees are receiving much less than the lowest income Canadian citizens. The third argument, of course, is that the changes will deter refugees from moving to Canada on grounds of superior access to healthcare. But I think that in escaping wars and famines, James, the refugees don't really care much about the quality of healthcare they'll be receiving. They have bigger issues to worry about.
Thank you, Robert. And your last question. This is from Refugee Revolutionary 114.
Okay.
And I quote, "What do you think of the recent changes to the refugee healthcare system made a few days ago?"
Well, James, I'm grateful to be part of such a wonderful country like Canada, where change is possible. I'm happy with the Conservative government's decision, which was forced, to be honest, to resume offering health care to refugee claimants. These past few months have been cruel for those seeking shelter from their respective countries. There have been concerns raised whether or not it was fundamentally right to deny the access of health care to those accepted refugees. I think that we're finally moving in the right decision and ensuring that those that are in our country do not have to worry about their health.
Right. Thank you, Robert, for your time. And I've heard that you have another colleague by the name of Bill Singh, a prominent Canadian healthcare authority. I'm pretty sure he knows much more about the topic, and if he played a game, he could make $1 million. Is that? Would you be willing to call them out?
Here, let me see. Bill, come on up.
Hey, everyone.
How's it going?
Nice to meet you both. Nice to meet you too.
Please. Well, I'll leave you folks to it, all right?
All right. Have a round of applause for Mr. Robert Johnson, please.
Thank you.
Thank you, Robert. Please, Bill, take a seat. Bill, I have a game personally made just for you. It's called Who Wants to Be a Healthcare Genius? Right? So, would you be willing to come to the game show site with me?
Absolutely.
Right. Let's go. Let's go.